Platelet-rich plasma, PRP, is a concentrated form of platelets that is extracted from a patient's own blood. Platelets are cells in the blood that are involved in clotting. They also contain growth factors, which are proteins that promote healing. PRP is used to treat a variety of conditions, including sports injuries, tendonitis, arthritic conditions, wound healing. PRP is thought to work by stimulating the growth of new tissue and by reducing inflammation. The alpha granule is one of 3 types of granules found in platelets. Alpha granules contain a variety of proteins, including growth factors, cytokines, and chemokines. These proteins are released when platelets are activated, such as when there is an injury. PRP is a promising treatment for a variety of conditions. It is thought to be safe and effective, and it has the potential to improve the healing process. Here are some of the growth factors found in alpha granules. Platelet-derived growth factor, PDGF. Transforming growth factor beta, TGF-beta. Vascular endothelial growth factor, VEGF. Fibroblast growth factor, FGF. These growth factors play a role in a variety of cellular processes, including cell growth, cell differentiation, cell migration, tissue repair. By stimulating these processes, growth factors can help to improve the healing of injured tissues.